Welcome to Healthcare Disrupted, where conversations, topics, and innovators share how they are disrupting healthcare to change a cookie-cutter healthcare system to become more innovative, creative, and result-driven. Now, here are your hosts, Rene, Lumene, and Jasmine, Vializ.
All right, welcome to our third episode, and we are pleased to have a wonderful guest with us. His name is Alex Arillo. I hope I said your name right, Alex.
You did.
You did good.
So definitely thank you for coming on the show today, and we definitely want to talk about your company called Quantify. For those who are listening to our podcast today, Alex is a co-founder of Quantify, and I'm going to go ahead and jump right into our discussion today. And for those who may not be familiar with you, Alex, or with your company, just if you don't mind, share a little bit of your background from a career experience and what led you to Quantify.
Sure. Okay. So my background has always been around business development, marketing, sales. I became an entrepreneur at a very young age. I always tell people my last W-2 was when I was 17 years old. Ever since then, I haven't filled one of those out. And throughout all of those years, I've been in different industries, mostly tech, some health, and nutrition. But over the last 10 years is when I really got into healthcare, doing consulting work for medical groups, IPAs, and really around the Medicare space. And it wasn't something that I searched for. I fell into it, and I really fell in love with it just because there was a business attached to it, but it's also doing a lot of good for the community, especially in the senior market. And from there, I started to get a really good grasp on how these organizations were doing business, how they were making decisions, and little by little, some of what I consider gaps, I started to share them with my business partners. And that's kind of how the idea of Quantify came about, just from what I thought were problems that organizations were facing, right? So, I shared it with two of my business partners, Dan Wang, which is our CFO, he's a co-founder, and Vac Sambath, he's also our co-founder. And we all bring different talents, both with, all of us with some healthcare experience. And that's where we figured, well, if I'm coming across this problem, maybe other organizations are coming across this problem. And then we just did what we usually do. We start calling people, asking questions, and asking them, hey, are you experiencing this problem? Are you experiencing this problem? We heard it enough times where we figure, okay, maybe there's a business here, right? And that was the beginning of Quantify, and kind of how we thought, well, let's see if we could do it, right? We didn't put a business plan together. We just went to work and started to figure it out little by little.
Just winged it pretty much in the beginning, at least.
Yeah.
100% winged it.
Yeah.
No business plan.
Yeah.
I dig it.
No, it's cool. And, I think sometimes, especially when you're in the healthcare industry and you notice that there is a gap or that something is missing. And oftentimes we understand that whenever a business is created is because there's a void in the market and somebody has to fill it. And so I'm pretty sure that's where you probably came into place to figure out, hey, we can probably do something and maybe it's already out there, but we can probably do it better. And so,
Right.
and so that's wonderful. And so I also wanted to ask you, why the name Quantify?
So it's a good question. You're the first one to ask that question, actually. So, when we sat down and we started to look at what we were going to build, we wanted it to be quantifiable, right? Something you can measure, right? But obviously quantify.com was already taken.
Gotcha.
And again, we had no business plan. We were like, let's see if we could do this. And we started to build it. So we were not going to spend thousands of dollars buying that domain from someone.
Sure.
Being Latino, being Mexican, I said, well, cuanta in Spanish is how much, right?
Right.
So I'm like, you know what? Let's just go with our version of it and put some Latin flavor into it and call it Quantify.
That's right.
that was really the reason why, so it was like quanta is how much, and phi, we'll quantify it, right? So
That's
it was
right.
our version of quantifying something.
I love it.
That's awesome.
And that's even better anyway when you choose a unique name, right? We don't have to battle for, like you said, the whole domain battle and trying to get, all your pages on the different platforms and everything. It's like everybody wants a buck for it, even if they just bought it as a broker. So very cool. So tell me, you were talking about gaps in healthcare. I'm very curious when you say gaps, what kind of gaps were you looking to fill with this platform?
So the biggest challenge that we saw was a lack of knowledge and data from the healthcare organizations, right? So you have the Medicare Advantage plans, you have the IPAs, you have the medical groups, you have the MSOs, you have all these big organizations, some big, some small, and they're all trying to do kind of the same thing, right? They're all trying to engage with physicians to either contract them, network with them, get them to offer their products or services. But they're most of the time doing that kind of ad hoc, right? So they're saying, well, we're going into this area and we have all these lists from different sources, and we've heard these doctors are the main doctors in the area, so we're gonna go and talk to them. And they host these dinners and they host these events and they invite people, but they really don't know who they're actually targeting, right? They really don't have a good knowledge of what does this physician really have in their practice as far as Medicare patients. And a lot of times they just rely on talking to a doctor and the office manager, and whatever they tell them, that's what they take for, as credit, right? They say, well, how many patients do you have? Well, we have 500. Oh, okay. So they start to base their decisions off that. Yeah. So we just figured there has to be a better way on how to get that data to make you smarter, because maybe you don't need to talk to 300 doctors. Maybe there's only 100 that you really need to talk to, because they have the patients that have the most need for your services or your insurance plan, right? So that was kind of the main gap that we saw, that these healthcare organizations were guessing as to who they should go out and talk to.
Right. Getting them away from the hope and pray method of marketing.
Correct.
I get it.
Absolutely. Absolutely. Yeah. And I definitely agree with you about that too. For me as a healthcare business consultant, I talk with providers all the time, even with executives in different healthcare organizations. And I tell you, I think one of the important things that they need is data, and being able to get quickly to make decisions. We all are in different aspects of the healthcare industry, and we know this is one of the industries. It changes so rapidly, new policies, things that can just truly affect business and how healthcare is actually provided within the United States. And so I can definitely see with, a company like yours that can basically provide the data for decision makers to be able to make on a day-to-day basis. That is what's going to really help set these organizations apart. And so, so I think it's awesome. So, okay. All right.
So switching gears a little bit. So we talked earlier about the quanta and quantify. So what exactly are we quantifying? What when we talk about the data here?
So when it comes down to the data, we Quantify, we've built a platform now where we have direct APIs into 4 major data sources. Number 1 is CMS, right? So we pull a lot of Medicare data from there. Number 2 is census. So we pull a lot of demographic data from census. HRSA, so all the FQHC data we pull from there. And the MPI registry, right? So those are the main 4 databases that we pull from. We do have some private databases that we own that we've invested into, and we merge them into the public ones. And what we found out is that once we started to develop these reports or this data knowledge, some of the organizations were coming to us and saying, "Oh, well, we think we have that in-house, right? We think I think our team has that." And what we started to realize, and I guess what makes us different than everyone else out there, is that one thing is we extract the data, we hygiene the data, we process the data, But then what we do is we actually build a use case with the data. So someone doesn't have to sit there and think, well, I see all these spreadsheets and all these numbers. How do I make sense of it? How can I get a one sheet that I can take and talk to a doctor about that he's not looking at an Excel file, right? So that's what makes us different. You don't have to think about it. You don't have to wonder what it's going to look like. It's already done, right? So we're able to generate the most common reports that we get requested for are PCP reports or specialist reports, because healthcare organizations, IPAs, medical groups, Medicare Advantage plans, they want to know how many Medicare patients does a doctor have, right? If they have 500, how many of those are straight Medicare versus MediMedi? What conditions do their patients have, right? And are they diabetic? Do they have hypertension? What percentage? How much are they billing Medicare? And from what they're billing, how much are they actually getting reimbursed?
Gotcha.
Right? How does that break into a per patient per month?
Right.
They also want to know what are some of the, the ethnicities that the patients fall into. And not only that, but we trend the data. So you can see the data for the last 6 years. And based on that, you can pretty much predict what the next 2 or 3 years will look like, right?
Yeah.
So all we need is a doctor's name and an MPI, sometimes not even an MPI. You just give us a doctor's name and an address and we generate the report for you. So it's really, really simple for them to find that data right away, right?
Got it.
Wow.
That's good. So tell me a little bit more, expand a little bit more on how an IPA, or as you said, a Medicare Advantage plan would use your system. And is there a particular example that you could share with us to help us understand our audience?
So IPAs are typically coming to us in one of 3 scenarios. Number one, they're coming to us and saying, hey, Quantify, we have 200 contracted physicians, right? These are all independent. They're not employees of the IPA, right? They're independent. We want to know who should we spend more time with in helping them grow their practice. So they give us a file, right? This is more of our managed service. They give us a file of all their doctors. We put it through our system, and then we build an executive summary. And then we say, oh, you're 200 doctors, they fall into these buckets. 20 of them have 500 or more Medicare patients. 50 of them have 400 plus, right? So we create the different buckets based on what they're looking for, right? So the IPA will want to know number of patients, how much they're making per patient per month, who has the highest MediMedis. So at the end, once we present the executive summary, they will look at that executive summary and say, okay, well, out of 200, I can see that I only want 89 reports. Because those are the doctors I want to go talk to. So then we generate those 89 reports, and they know that the reports that they're generating are useful. It's not, hey, I ran 200 and out of 200, only 89 are useful, right? So they're not wasting money.
Right.
The second scenario is they'll come to us and say, hey, I have this list of doctors I want to contract, but I don't know who's good or not, right? So same scenario, we run it, we tell them, okay, out of your list, based on your goals, here's who we think you should go after, right? The third scenario is they come to us and they say, we have no list, right? But we're going into this new county and we want to find doctors that fit this criteria. And we have about 10 or 15 different items they can pick from. And we say, okay, great. We go into our database, we go into our software, we look up the county, we can do it by state, county, city, zip code, whatever it is. And then we build a list for them and say, based on what you're looking for, these are the physicians you want to talk to.
Gotcha. So Alex, I have a question for you.
Sure.
When your clients are requesting for these data, how long does it typically take for you guys to pull that data, make it look pretty, and present it to them?
So if someone has the doctor's name and MPI, and the MPI has data, it could be, if they put it in order today, they could get it within 20 minutes, an hour. It just depends on how the log is, right? It's automatic.
Okay.
The ones that take a little bit longer it's when we're doing executive summaries, because they're giving us a huge list.
Mm-hmm.
We have to put it through our system, and then our team has to analyze it. Once they know what they want to run, it's fast. We generate reports within 60 seconds, right? It's longer just getting it over to them, and that's it.
Okay.
Right. And you generally present this to the client and have to explain it. It's usually something that they understand fairly easily and are able to interpret and know how to use that data.
That's a really good question. So what we've learned to do is that once we understand the client's goal and what they want to do, and we run the data for them, and they have their tools ready, then what we do is we like to schedule a training with not only the executives, but the people that are actually going to go out in the field and train them on how to use this tool, right? Because they've never seen it before. So because they're not familiar with it, right? So we train them, we make ourselves available and saying, hey, if you guys have questions, let us know. Because you might look at it, think you understand it, you got on the field, you get asked a question, and then you're wondering, well, how do I answer that question?
Right.
So that's how we support our clients, because if they're successful out there, they're going to continue to do business with us.
Yes, I think that's probably a really great value add too, because it, really being able to make it something useful that folks that are going to be on the ground can utilize, and
right.
confident in presenting that data to the providers as they have those conversations. So yeah,
right.
That's excellent.
Yeah. So another question that I do have, so, because I did have an opportunity to go through and look at the Quantify website, which looks pretty nice. I thought it was well done. And I know you mentioned that IPAs would be, your clients, but would hospitals also be a client of yours as well?
Hospitals can definitely be a client of ours if they're what you consider like an IDN, right? An integrated delivery network, or any hospital that has a network of physicians could benefit from this. Absolutely, 100%.
Gotcha. Okay.
Right.
Yeah, 'cause I think about like the HCAs, the Baylors, and these are healthcare systems in Texas, but I'm sure you have other healthcare systems in other states as well too. So okay, awesome.
Yes. Oh, and I wanted to say, you mentioned this phrase MediMedi a couple of times, and some people who are not as well versed.
Sorry.
I know it. So in the California world, it's a very common thing. It's
yes.
super popular. So you want to expand upon what that means when we say MediMedi?
Sure. Sure. So that's our term for individuals who have Medicare and Medicaid, or in California, we call it Medi-Cal, right? But they have both insurances, right? So they have Medicare and Medicaid. That's what we call MediMedi.
Yeah, that's that insurance vernacular right there. I knew exactly what you said when you said it, but I want to make sure our listeners aren't like, he keeps saying MediMedi, I don't know what he's talking about, or thinking the same thing, Medicare and Medicare, which is, not impossible, but not usual. So.
Right.
Awesome.
All right. Yes.
All right. Yes. Well, so now I guess in regards to, so right now the company is located in California, right?
Correct.
Okay.
So we're based in LA. That's where we live. Most of our clients are in California, Texas, Florida, New York. Is it New York? We have but mostly those three states: California, Texas, and Florida are the ones that we've started with.
I got you.
Have limitations on areas that you can operate?
Absolutely not. We cover the entire U.S. So anywhere in the U.S. that there's a physician that's either part of any of those 4 databases, we can pull data on those physicians. So no limits.
Great. So like if a health system or a group is looking to expand into a new region outside of California or any of the states that you're operating in, they absolutely can use you guys to evaluate their options.
That's correct. That's correct. Yeah, we cover all 50 states.
Very good.
So as a business owner, right, and really all of us are business owners here, one thing I constantly think about, especially with my company, is how can or what can I do to continue to make it evolve, especially
Mm-hmm.
times. And, especially when you look at the current situation where we're with coronavirus, right? I think it caught
Right.
a lot of people in healthcare off guard, especially, healthcare systems and even private practice providers, where they're having to try to help and implement telemedicine just to keep their patients and not lose it and still generate
Correct.
some type of revenue. So with Quantify, we know that this is really a data-driven company. How do you see it within the next 5 to 10 years as a potential healthcare disruptor, right? To disrupt healthcare in such a way where it's going to make a big difference to truly improve care and outcomes.
It's a good question. It's something we probably think about every day as we try to build our business, right?
Mm-hmm.
It's how do we not only grow, but how do we provide value? And kind of touching on the whole COVID-19 thing, right? When that happened, we're a fairly new company, and we had just kind of gone out in the public and started talking about Quantify to our network, and then this thing happens, and all of our conversations just paused with clients, right? Because everyone's like,
Yeah.
what's going on? But we're strong believers that everything, there's always, where there's a problem, there's a solution, right? So one of the things that did happen was a lot of doctors, just personal connections that we have, reached out and said, hey, they were just trying to find out what's going on, right?
Mm-hmm.
And what we started to realize is that a lot of these doctors have relied on kind of the old model, right?
Mm-hmm.
Fee for service. You show up, I see you, I bill, right?
Right.
You show up, and I try to do as much as I can to bill as much as I can to get paid as much as I can.
Totally.
Well, that goes out the window when people can come to your clinic. And
Right.
It's unfortunate because a lot of, this really has a downward spiral because a lot of these practices may not survive.
Mm-hmm.
And, they're sitting there and they're not generating the revenue. So now they're freaking out. And, till about 6 weeks ago, we didn't even know this existed, which is RPM, remote patient monitoring.
Mm-hmm.
And these organizations started to reach out to us along with chronic care management organizations, which
Right.
allow the doctors to put some of their patients or the patients that can benefit from it on these programs, so they can continue to get care, right?
Right.
Especially the chronic. And it allows the physician to generate money without having the patient come into the clinic.
Right.
So for us, being able to provide these RPM and CCM companies the data they need to know which doctors to reach out to,
Right.
it's a huge impact, because we know that we have a little bit, we're impacting a little bit of that patient's health, right? Because if they could get to them fast enough, they're going to be able to get on these programs fast enough. So that's how we feel that we're adding value right now during this current situation, and also educating the physicians themselves, because they don't know, right? They're used to their models and
comfortable.
From my
That's the word, right?
they're comfortable.
We've all been very comfortable for too long.
And I think for a lot of them, it's hey, it's not broken, don't fix it, right? Leave it alone.
Very much.
And most doctors are really good physicians, but not really good business people. And I tell everyone that's how we want them to be, right? We don't want them to be good business people. They're meant to be doctors. But even educating them and saying, hey, doctor, this is how much you were making doing fee for service. Mm-hmm. This is what you could do, providing your patients great service through these other platforms.
Right. And the end result is a really amazing, I think, stronger healthcare system for the population, right? For the greater good of society, even us, right? If we don't have
100%.
to go to our doctor every single time and sit in their office and pay the copay and spend the amount of time, and the folks that are in the rural areas that can't get there, I think it has a huge perk. So I agree.
Yeah, there's a lot less waste. I do want to touch on something you said. Long-term wise, how do we feel that we're going to disrupt healthcare, right? Mm-hmm. Well, right now we're servicing the healthcare organizations. Yeah, we're the executives, the decision makers. But just in the little bit of time that we've been in business and the data that we've collected, we feel that in the next 2 to 3, maybe even 4 years, we'll have enough data to really give a transparent view to the consumer about physicians.
Oof, game changer right there.
Absolutely.
So we're,
Yeah.
you know, we're working on a few things on the back end. It's going to take some time,
Sure.
but to us, it's, hey, you're relying on these professionals to take care of your livelihood, right? For you to continue to live and breathe and be okay. So you should be able to know as much as you can about these doctors, right?
Absolutely.
Yep.
So that's our goal in the next 3 to 4, 5 years.
I love it. That's great. That's a huge, I mean, like you said, game changer right there. I think that that's absolutely something that everybody can use, right? It's, we're all kind of taking a chance when you read the Google reviews, but you have to wait for your own experience after
Correct.
months, weeks, when your outcome is not as you expected it to be with that particular.
Yeah, that's correct.
Yeah.
Absolutely. Awesome. So for me, Alex, I think, so one other question that I do have to, because, so as far as the service, right, that your company provide, is it one of those platforms where people can basically go in and run their own report, or is it just your company is going to basically run the report, make the report look pretty every time for the client?
So up to this point, it's always been white glove service, right? So if someone comes to us, it's not, I wouldn't say it's customized every single time. The executive summaries are customized, but the reports themselves, there's a few templates that are standard, right? So it's not self-serve at the moment. In the next maybe 20 days or so, clients will have the ability to just request a report, and then they will get an email with it. But it's not something they can go and then download right away today. Reason for that is because we wanted to really have an experience as to when someone gets that report in front of them, are they going to know what that report means?
I got you.
And how to use it? Because if they don't, what's the point of it, right?
Sure.
So instead of just letting someone go there and run all these reports, we really wanted to develop a relationship with our clients to make sure that when they're getting it, not only are they excited about it, but they know exactly how to use that report to meet their goals.
Absolutely. And I think that's a wise approach, mostly for the fact that you end up losing people in data overload when you just hand
Correct.
report. I mean, even if you present it, or it is presented on paper in a very, what we would think of as easy to read and understandable format, you don't really help them to understand how to utilize that data and give a really kind of a better synopsis, even verbally. Most people aren't going to be able to take action with that data. So yeah, that's great. I have a question as it relates to the customer side. So are you kind of a one and done, or is this a relationship that you want to continue where you have a longer term recurring relationship with your clients?
So that kind of piggybacks off the other question, right? So till this point, it's been more of a project-based service, right? So we engage with the client, they tell us what they need, we develop the reports. It does continue the relationship continues to build for the simple fact that now that they know what's possible, they're coming back and saying, well, what about this? What about that, right? We're going into a new market. Can we repeat what we did in this market? So now we're moving into more of a subscription-based model. So instead of you just putting in an order every single time, there'll be specific packages you could pick from that allow you to run X amount of reports, any type, any template, for a fixed cost every month. We will still offer our managed services for clients that have more of a higher touch need that requires custom work. But for someone that already knows, hey, this is what I want, I already know what the report looks like, I just need to run X amount per month, they'll be able to do that within the next 20, 30 days or so.
Okay.
Yeah. Do you recommend that? So we talk about the example of the marketing team and equipping them. Would you recommend that that's a relationship that an organization or practice would use you guys for on an ongoing basis every time that they're looking to evaluate their strategy on a quarterly or annual basis?
We've done research and we've done some case studies with some of our clients. on average, we're saving them anywhere between 30 to 50% of the time.
Mm.
And I mean, we haven't pulled hard numbers, but I would say on the low end, we're probably saving them 6 figures plus
Wow.
versus them just going out there blindly. Because we've sat in front of organizations that give us Word documents and saying, here's a list of providers, right? And it's just doctors' names. And these are big organizations.
Wow.
Or they have, it's interesting what we see out there, right? So we know the moment we see that, we know we can totally help them and cut their time, increase their efforts and their results. So I wouldn't go out into a new market without having this data. Absolutely not.
I love it.
Absolutely. Well, so for our listeners out there, please
Sure.
let them know, how can they get in contact with you or get a hold of somebody in your company if they want your services? So what would that look like to them?
Easiest way is just go to our website, go to quantify.io. The .com will be up shortly, but that's the fastest way. You can find us on LinkedIn. We're also on LinkedIn. I'm very active there. So those are probably the 2 easiest ways to get a hold of us.
And I just want to make sure with the spelling with Quantify.
Sure.
Okay, the same thing, just to make sure we're saying that.
So Quantify, right? So it's Cuantafy.
Okay. .io, right?
.io, correct.
Gotcha.
Correct.
Gotcha. Wonderful. Wonderful. Well, I don't have any other questions. How about you, Jasmine?
No, this has been great. Very informative. Thanks so much for sharing about Quantify, Alex. It's been a great
Sure. Thank you guys for having me, and look forward to connecting with you guys further. Thank you.
Yeah,
Absolutely.
Thank you for listening. Be sure to check back for new episodes of Healthcare Disrupted. Find out more at www.healthcaredisrupted.org. Until next time.